Oh,
It's kind of the same thing as.
okay. 6 p.m. We'll call the meeting to order. Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we'll move down to item C. Approve the agenda. Do I have a motion?
I move to approve the agenda.
Do I have a second?
Second.
Any discussion? It's been moved and seconded that we approve the agenda as presented. All those in favor signify by saying aye.
Aye.
All those opposed? Item passes. Okay. We'll move down to item D, our work session for this evening. There are 4 items on it. We'll start with the school level close contact protocol, then district policy 5113, the student attendance. Item 3 is leadership governance, board self-evaluation, and then 4 is other topics for board discussion. So with that, I guess we will go into discussion over our school level close contact protocol. Where's everybody at with this, I guess, is the best way to put it. I can tell you my stance on it. I think it's time to do away with it. I think it's time it goes away. And then if that is the case, then we reinstate our attendance policy.
I'm with you 100%. I think it's time to do away with it and move on. This is pretty much all we get done until it's gone and done away with. We're not going to get much else done other than work on this. There's more important stuff to go at, in my opinion.
What becomes of the contact tracers if we remove the protocol?
That would kind of be up to what we want to kind of pursue and see what other job positions, if that would be there. I still think we should be informing parents if their child is a close contact. I still think that even though the Department of Health has not done some of the things that I would expect the Department of Health to do in regards to notification or questions or those type of things, I still think there's an obligation from the district standpoint, from a health piece, to notify parents if your child has been in close contact. I think also in regards to anything when we have a situation where there is other typical situations within schools, we've done that with a nurse and then employing those individuals since we're available to still provide that service. I think is important for families to at least have that knowledge. And I certainly as a parent would appreciate that if it's reported to a school that there has been a positive case, to know that my child could potentially be exposed, and the possibility to watch for signs and symptoms.
So without the protocol in place, that would be just letting them know. So you have a kid test positive, they can still come to school,
There could be,
but people are made aware.
there could be multiple layers. We could do that where it is a process developed by the nurses in regards to providing information as they have with other viruses, or in relation to this, we could draw this up to be, I think Trustee Hager added the words recommend rather than required in some of the portions, and give some of those pieces.
That's, like, as I kind of said, my stance on it last meeting, but that's what Mr. Kramer said. That's my take, is I'm fine either way. My biggest thing is we've been doing it for 2 years. And it's very hard to I don't even know how to word it. It's just very hard for everybody to enforce consistently. I mean, plain and simple. It just is. It's from every aspect, every level. There's been just numerous occasions where people mean the best. I mean, they're not trying to cause drama and hurt people and disrupt the day, but it's just hard to get the entire district to enforce it evenly all the way across in all buildings. It doesn't, and it won't, we haven't been able to do it. So that's what's hardest part for me. So I'm good either way, either getting rid of it or, giving people the choice to follow it or not. I feel like, if you completely take it away, you really aren't giving everybody the choice, because you're not, kind of like Mr. Kramer said, you're not letting them know if they were a close contact or not.
So would you say then you're in favor of maybe modifying it? Is that to where notify?
I just think there are still some people that would feel safe getting a phone call saying, hey, your son came in close contact with so-and-so. Here's your options. You have the choice to follow what we recommend or don't follow what we recommend. I don't know.
I just think the worst problem with the whole thing is if you keep having the phone calls and keep all that stuff, it's gonna get twisted around more into, well, we're still getting these calls. This is still going on. I thought the protocol was optional and not in place. I don't know. I just think it's kind of, as long as we keep adding to it or changing or going with this or that, it's just gonna be a continually, until it's gone, I think it's just gonna be a continual changing, fixing. That's what our meetings are gonna consist of, I guess. That's my biggest concern.
I agree. And it still is going to get twisted no matter what. When you have that many people trying to communicate the same thing, not everybody agrees with it. It gets twisted. It has been the entire time. So I'm good either way.
Superintendent Kramer, do you know what our protocol is if we have a positive case of measles in the school district?
I honestly don't know offhand. I would guess that it definitely, we have one of the communicable disease policies. You can kind of check and see what we have under there, what those protocols are, but they'd be specific to the nurses in regards to information, how that is then handled by the Wyoming Department of Health. Also, I know we do involve them very quickly with a measles outbreak, or I think there's a couple of other lists in regards to which ones we actually have specific protocols that they follow and help us with.
Would it be reasonable to treat COVID and measles kind of in the same way, since they may be as communicable as each other?
I think that's not a bad idea. I would hate to see this go away completely. We are not completely out of this pandemic yet. Looks like maybe we're heading in the right direction, but there could be another mutated variant that could be even worse. And I just am one of those people that you prepare for the worst and you hope for the best. And we have prepared this. And if we vote that it's no longer appropriate right now, that's one thing, but to completely get rid of it, it just seems a bad idea to me.
I'd have to agree. I guess the thing is past the point of it being a state mandate, there was nothing we could do about that. When it fell into the point where we had to, or we could actually make that decision, you know, there was an argument of going to the extreme of everybody wearing a mask. So I'm not understanding how we go from one extreme to the other and say that's okay. I was an advocate for the masks. I think that now, because of the fact that there are different options, you know, and families do have the options of vaccinations or not vaccinating, or, you know, continuing the choices of social distancing and following those protocols, there's more options. And, you know, as we have talked about, you know, when you know better, you do better. And the fact that I guess I go on is I don't think that it'd be a good idea to do away with it all. I do agree that maybe we can lessen it a little bit to be able to actually inform people, continue with options as to the possibilities of what could happen, and they have options to go from, but to do away with it all, I'm not sure that extreme is the best choice.
I agree with Trustee Salcedo from some standards. I'm not one that lives in fear of another outbreak, fear of what's to come next. I like Dylan's, Trustee Hager's idea of options, the 3 options to allow the parents to manage it themselves after they're notified, if they're notified. And the third thing I'd like to say is this whole thing needs a time frame put on it. For example, the end of the year, and then it's dropped. I mean, if you have a goal you're looking towards, you have everything in place, you need the time frame that you sit within.
And as long as there's understanding that it's the school close contact. So people that are getting calls aren't necessarily going to be getting calls from public health. Am I correct, Mr. Creamer?
That is correct.
So when somebody's getting a phone call, it's because you all have been notified that we have had an individual that has tested positive. So then the close contacts calls don't necessarily come from public health. They will come from our personnel, where at that point, there is no documentation from public health. It's just pretty much us. Right?
Are the calls at this point coming from public health?
I'm not aware of any.
No.
Public health quit contact tracing over a year ago, didn't they?
Yes.
Yeah.
So
But
there's no public contact tracing happening at all.
correct. It's just that in some comments, there was the argument that they weren't getting notified by public health or documentation by public health. So
They're
when,
not, I don't think.
correct. But the arguments were being made that that's why they wanted this done away with, because not even public health, or they weren't getting calls from that entity.
Oh,
And just to kind of expand on what you were saying, Trustee Saucedo, it's our legal obligation to provide as safe an environment as we can for the students who are required by law to be in school, and our employees as well. So we have a burden that maybe public health doesn't have.
Agree.
I won't go too far into the burden, legal burden, but I do think we also have legal burdens by how we've been trying to implement this also. Numerous times I feel we're walking a very thin line on just the legal consequences on what we're doing. When the main lawyer can't tell us exactly yes or no, if we have the legal right to implement it, it says something.
You know, and I think that's valid. The only thing that I would have to say to that is that, and again, it's on a different level, lower level from what we're talking about, because we haven't had the experience of having to deal with the pandemic and coming up with protocols, procedures, and laws. But I guess when I look at CPR, there are laws to protect those that in good faith, they do anything they can to keep a person alive. Good Samaritan laws are put in place to be able to make sure that those individuals who are in good faith, trying to keep persons safe, I would probably guess, I would hope that the judicial system would look at this in the same way. We're trying to keep people safe. We're trying to keep community members, school, faculty, administration, and students safe. So although there may not be precedent to this pandemic, I think there's precedent in different ways to be able to say there are ways to keep people safe, and we've done our due diligence to try to do that.
Without hopefully infringing on their personal rights.
Yeah, absolutely. Absolutely. Thank you.
So I think what I'm hearing is if it was our policy was to notify of any close contacts and then let the parents make the decision, is that kind of where we're at as far as how to word it on the agenda or how to put it on for a meeting or something like that, I would say. And it's just a recommendation. It's notify the parents.
Notify the parents, let the parents choose what's best from them.
And is that kind of what you said too? Yeah.
Yeah, we can build that. That would be certainly, and I can send it to chairman and vice chair beforehand to see if this follows the line of what kind of they were thinking or hearing, and possibly another board member to just make sure that we have it out in mind and this is what works and everybody's on the kind of same page.
But I think we also need to look at the fact that if things get serious again, we need something to pull from that's a little bit tougher than just parents' choice. We do have an obligation to keep students and faculty safe. And so, I'm okay with this point in this pandemic that we, say contacts or close contacts are notified, but to do away with it completely, because hopefully this pandemic is coming to a close. But with our world as transient as it is now, this is not going to be the last one. And I think we need to be prepared for that.
So just for clarification, so are you asking that in what's going to be written up, that they add that this will be reevaluated if the current trend of COVID cases or an increase of COVID cases,
Yeah, or
This
any
protocol
public
will
health.
be-
I mean, any public health, and COVID might be over, but there could be a different pandemic down the line. So I wouldn't want to just limit it to COVID.
Well, don't we have, I mean, doesn't the superintendent still have the overriding authority on any health thing? I mean, if Kramer thought tomorrow that the measles broke out in the secondary classroom, he can, policy or not, he can.
Well, and essentially the past 2 years have given us the framework to deal with, with a pandemic that comes up or any kind of communicable thing that comes up. I mean, we've learned more in the past 2 years about any of this stuff than we have in the past 50 years.
And so I would say that the framework's there. If you need to reinstitute a policy, all it takes is a meeting to do it, even if it's an emergency meeting. Whatever the case may be, I think that you could institute this policy at any time, or whatever policy at any time. We have the framework, and we have the knowledge now based on how the last 2 years have went.
And can I just have clarification? We keep calling this a policy. This is not a policy. Is that correct? It's just a protocol.
That is correct.
So we need to stop calling it a policy, because I think that's part of the confusion, is parents are saying this is policy. No, it's not. This is a protocol that we have developed to help keep kids safe. And so, you know, if we had something in policy that you could pull upon when needed, that'd be different. But right now, it's just a protocol.
So can I ask for clarification when this was asked to be, can somebody clarify me again, the goals of looking this over to be rewritten or to, how was it supposed to be modified?
As far as, I guess I don't understand your question.
Well, when the work session was, when we asked to, or someone asked to actually have the work session, and this was to be put on the agenda, what was the goal?
Talk about it and do what we're doing right now. Figure out what we want to do.
And I think clarification, there are still a number of issues within the district. There's
Okay.
not uniformity throughout
So does somebody have
schools and
those
how
questions?
things are being handled.
Does somebody have those questions? Because I guess here's where I guess I go with what Carrie's saying, and I agree. You know, we can always actually kind of implement this at any point if it ever came down the line. The only thing that I guess I've been trained to do is that if you're going to fall back on a plan, make sure the plan is complete and concise so that if that was to happen, you're not looking at a plan that is incomplete, that's broken. So I guess the thing is if that's what we're gonna do, if we're saying, okay, we're gonna have these recommendations, we're gonna go, you know, where they have that choice, but we're not gonna actually totally put this in place. What I'd like to be able to do is I'd like to be able to actually find out what was not clear in this, clarify it, so that if it ever was to be fallen back on, this could actually be complete. And that way, again, we know it's there, complete. So I guess, what was it that was not clear or questions that need to clarify?
I guess I'll go first. I don't know exactly. Might be a little confused on the question still. I was clear what this protocol meant the entire time. I just think we needed to have a work session where we all sat down at the same table and had communications about whether we believe at this point this protocol should be enacted or not, or if we need to change certain things about it. I think that's all I wanted. It was only me, the work session, just so we could all sit down and talk at the same time.
So your was an all or nothing, because you're pretty, this is pretty clear to you.
I mean, for what it's saying in the protocol, yeah, I don't.
So
I don't have
if we were still,
questions about
if we were still in a place, again, hypothetically, if we were in a place where we were a year ago, okay, this protocol was in place, you'd be okay with it.
No, I mean, I can't say what I would have done a year ago with this in front of me or what I can do a year from now with this in front of me. I think throughout the last 3 months, we've made changes to it when we felt we needed to make changes.
So I think for myself, I mean, just to answer your questions, I would say we need to find out a way, if we would ever have to use this again, to make it, simplify it. And then our implementation we have to be consistent regardless of the situation. And that hasn't always necessarily been the case. And I know it's tough because we're trying to basically come up with something on the fly. I mean, this isn't a position that we have ever been in before. And so I think that it generates a lot of confusion and a lot of, headaches. So if there's any way we can simplify it, if we'd ever have to use it again, as well as figure out a way to implement it more consistently.
Here's where, okay, and I'm doing a lot of talking, so shut me up, anybody that wants to have anything else, add. The word consistency, I have difficulty with the word consistency, and it comes from where I work. And the word consistency, if we actually were to ask everybody, define for us or give us your opinion of, how consistency works, I think everybody would come down to a consensus that consistency is that everybody is doing the same thing in every situation as much as possible, right? There is absolutely, and when I train, that's kind of where people go with the word consistency. And unfortunately, the thing is I can't do that, for example, with 7 of my staff, because 7 people trying to get on the same page, trying to do the same thing, it's impossible. So when we're talking about a district, it's going to be even harder. I like to use the word fidelity, because when we're talking about concepts, if everybody is understanding of the concept, then what has to happen is it allows for a little bit of flexibility in that not every situation is going to be the same. You're going to have to look at other people's situation in a way that says, okay, what works, what's best for this family? And to some degree, you're going to have to keep the concept, because again, we're talking a pandemic, okay? But the fact is we have families with special needs, okay? And the fact is if we're saying consistent, then that kind of checks those families off. Because the fact is we're saying this is the way it has to be. Fidelity means that we're going to stick within the parameters that we have to. However, if you have a family that has a special need, we can actually kind of modify it to the point to be able to actually work with them within the parameters, such as the CDC or however else. We can work with them within certain parameters, but still be flexible to a certain point. Does that make
It sounds
sense?
to me like you're arguing that we get rid of it and let the nurses make the best decision on each individual child.
No, I'm not. No, not.
Because if
not
we're
that
trying to take every individual into account, wouldn't it make sense to do that on a one-on-one basis instead of an overarching
No,
protocol?
because the thing is we still need that structure to use.
And we already have structure. I mean, if a kid has a fever, we send them home. If a kid is sick, we try not to send them to school. I mean, we already have the structure for health and
Right,
safety in our schools. So
But we
why do
have
we
to
need
have
that additionally?
we have to have it written down.
And we already have that written down. Don't we already have sick policy within our district?
In our student handbooks at the building level, yes.
Right.
So if we already have that, isn't that kind of, and then the nurses, one-on-one, look at the individual student and figure out what's best for that student and their family?
Right, but when we're being asked to give families options,
Mhm.
those options aren't written down. If we're talking about, we're going to go with the way the nurses do it, those options aren't given. And from my understanding, people want options to this. So that part isn't in what you're referring to.
Just COVID specific is what you're saying.
Go with Carrie, COVID or anything else that may come down the line.
So when you're referencing families that have children that have special needs, would that be the case then for them to not have to wear a mask during, if we had universal masking? I mean, it's essentially the same thing where, yeah.
It's exemptions.
yeah.
It's.
So that, for instance, a 504 or anything like that, that exemption should hold true regardless of what our quarantine protocol is or whatever the status of our masking is in the schools. Is that?
The problem is it wasn't.
Right. Well, again, we're building the plane as we're flying it, but now that we've come to the table, I think we need to open up and listen to each other to come down. We're not where we were 2 years ago. We're not. But the fact is there's still some areas that need to be clarified. There does need to be follow through. But here's what I'm also going to say. I don't know how everybody else, if everybody else has experienced this, but I have experienced this at basketball games. I've experienced at plays where I have seen our administration try to follow what we put in place. I have seen the unprofessionalism. I have seen the ugliness of how they were treated in trying to follow through with that. And that for me, I want to work with people to be able to have that not happen, for us to be able to come to the table and for people to be able to be treated with dignity and respect, be heard on both sides so that we can come to an agreement that we can all live with.
I agree with Carlos too. I've seen it exactly how Carlos has said that. Set flip-flopped. Exactly, flip-flopped. So the ugliness, the inconsistency, between the administrators picking and choosing what they want to enact out of this towards people in the district. So it goes both ways and it has gone both ways. That's one of the main problems.
And I don't think, I'll let somebody else.
So the original reason for this protocol was to try and have a place where we could maybe come together a little bit to where we don't have universal masking, but we're also not quarantining whole schools at a time. And so that's from my view, that's what this whole protocol was initially. That was the whole idea behind it, to find some sort of middle ground to where we can potentially find a way to work together. So that's just the way I saw this when we were putting it together.
I absolutely agree. I think that's exactly what it was for. But the feeling that I get from people I've talked to are the fact that people aren't going to be happy until every bit of COVID has been wiped from what the school does. And the simple matter of fact is we can't do that yet. It is still there. And so keeping something in place that does limit the masks, but makes the people that, like myself, I'm a believer of masks as well, when there was a need, that there was a middle ground here. And I saw this as a middle ground, but taking it away, there's no middle ground anymore.
So I guess my question to the ones that don't want to take it away, are you saying where you want to keep this as it is, and you're still saying that when your kid is labeled a close contact, that they have to be one of these options? Or are you guys saying we're just going to keep the contact tracers, they're going to make the call and say, this is what your kid's been labeled a close contact. We just want you to be observant. You make the best decision for your kids. I guess that's my question.
I can live with that
For you
as
guys.
long as if the need ever arises, we can bring it back with more strict guidelines.
I don't know, how would we ever determine the need though? I mean, between the 9 of us, what, could we write something down saying this is what would enact this policy on what needs? I mean, we could never agree on what the needs are. Nobody. The country can't even agree on that. I mean, if we could write it down and all agree on what those steps could be, but better go start the coffee pot.
I think you have to take everything that comes along as it comes along and evaluate. I mean, the next thing that comes along, whether it be another variant or a whole nother pandemic, this could not even be relevant to that.
Oh, I
So
agree.
I don't think that I don't think you can put something in place and say, okay, this is what we're gonna go to if this happens, but you have to be able to pivot and be able to make those calls as they happen. And I can see, having a framework, which we do have. I mean, it's here.
Yes, I agree.
So but as far as, like, say, I don't think we can say that anything that comes down the road is gonna be, like, say, this could be completely obsolete and not.
But doing away with the framework bothers me.
Yeah, well, I don't know that you can do away with it because it's here. I mean, we can always adopt it again if you need it. Are you wanting to put it into a policy? Is that what you're?
If we have to look at that, I don't know. I don't know what the right thing to do is either, but we are not out of the pandemic yet. And so doing away with it completely when we are not out of that pandemic is, to me, foolhardy. It just is. I mean, we talk about the cold weather, and we are from a state that knows how to prepare for cold weather or for a trip in cold weather or a blizzard. And you get ready for it, and you take boots and clothes and blankets and food and whatever, and you take all of that and you get ready for it. And to not have something that is a baseline to be able to say, okay, this is what we did for COVID. What can we do now? What do we need to do? But at least we have a baseline for it. If we all feel that we can, at this point in time, say parents' choice, I'm fine with that. There just has to be some way that we come back and say, okay, we've had 5,000 deaths.
So that being the case, regardless of what happens, us 9 would have to come together in order to put something in place regardless. Is that correct? So
I don't know.
I mean, so because I don't think we can tie it to a number or a metric or whatever.
No, I'm not asking for that. I'm asking to at least keep a framework in place.
Mr. Chair, I mean, one of the things I think that I'm just hearing, and maybe it just is that, I think everybody stated that they'd be okay with changing this to complete recommendation, that this is holding it, and then it makes it a recommendation for all families involved. And that maybe is that next step in that process. I do think there's a couple of changes to be made, because I think there have been things that have changed in regards to the testing and PCR testing versus antigen testing. I think those are editorial type changes that could be fixed very quickly. But I think, if I'm hearing everything correctly, that there is the possibility, and has been a suggestion for completely doing away with it. And I think there's not yet consensus regarding that. But when we go a little bit higher to changing into, this is a recommendation, that there seems to be consensus around that. But I could be reading that wrong. I mean, if I'm reading that incorrectly, I don't want to belabor or question that if I'm misinterpreting that.
Well, and I think if you're wanting to put something like this as a policy or something, I think that's a different
discussion than what we're gonna get tackled tonight. I mean, really, I think that's where.
I'm
you
not
know,
asking
yeah,
for that discussion.
Yeah.
I wanted to clarify, this is not a policy.
Right.
And it's not. I don't intend for it to be a policy. I just want to keep a framework in place so that if things change, and I know I've heard numerous people, numerous parents say, we just need to keep kids home if they're sick. And 99% of the parents do that. But with this disease particularly, one person, that 1% could close a school. And so we can't just count on every parent, every staff member doing the right thing just because it's the right thing to do. So we have to have something in place that we can come back to if we need to.
So I'm not, again, maybe. So with the change to recommendation, walk me through how that's going to work. Walk me through from beginning to end of how it can look so that I can try to picture it.
So the change would be, rather than a nurse or one of our contact tracers asking for a parent, hey, can we know what option you're going to choose? We're recommending that you either choose that your child wears a mask for the duration of the quarantine timeframe, 10 days from exposure, or an option 2, taking a PCR. And as I referenced, now with the availability and reliability of antigen tests, changing that to just a COVID test, or option 3, just staying home for that quarantine period. Again, that would be a recommendation as opposed to a requirement. The other piece that I think is kind of something that may, and I don't know the thoughts on this, but also just trying to be providing parents as much information as possible, is in addition to that, providing the number of students that were close contacts that are making a choice to just come to school in a regular fashion. I think it's kind of important for other parents to know within a school setting also. I think that would be how my conversation would go. That would be how the nurses would, I think in any other situation also handle those. I did reach out to one of our nurses to try to answer your question in regards to measles, but it really involves heavily the Department of Health, and then looking at a number of factors there with them, and they kind of take over that situation and that. So I don't know that we can relate it perfectly to this, but sorry to hit 2 questions with one answer
So
there.
basically, it's just when the nurse calls, they would say, we are recommending option 1, 2, or 3, then they would need to follow up with, still let me know which option.
And that would be kind of apparent on what they were going to be doing and coming to school, because it would kind of be showing exactly what the choice is being made.
I know. I was just gonna say, a couple weeks ago, my oldest son was a close contact. So I had, I don't know, 3 or 4, maybe 5 conversations with Miss Lewandowski. And I can say she was wonderful to deal with. I can't go in super detail on what we talked about, but I kind of did ask her some of these rough questions, and I kind of used the word recommendation just to see, what she thought about that. She, in her opinion, she thinks the overwhelming majority of people would still choose one of the options, even if you use the word recommendation. It gives the choice to some of the people to not follow the options, but she felt great majority of people would.
So that's the piece that I need clarification. If they choose not to, what do you mean by that? What does that look?
They would go to school.
They just go to school.
And I think. I don't know, there's a difference between obviously the word recommendation and notification, and for me,
That's where it's sticky.
yeah, for me, I honestly, I mean, notification, you're gonna notify them, is one thing, but I don't know about the recommendation.
I think that, we were talking about using the term notification when, if someone was a close contact, just to notify them that they were a close contact. But it still has to be.
I mean, obviously, parents need to monitor for symptoms. I mean, if they're a close contact, monitor that but I think that's gonna be the case no matter what. So I don't know. Recommendation and notification are two different things.
The concern that I have, and it still sticks in my mind though, is that during, again, these several months, I have heard, again, specifically regarding the masks, that it's not one's responsibility as to whether or not somebody else, I'm not wearing it for you, or it's not my responsibility to take care of the other person. That's my concern. My concern is if we're saying, okay, we're recommending or notifying you of these 3 options, but you don't have to take it, and you can just go to school. That type of mindset concerns me. And I've heard it.
It goes both ways, though. I mean, the other type of mindset concerns lots of other people too. Because at least with a recommendation, you're offering a choice. Without it, you're not. You're just offering a mandate.
No, a mandate is you're not giving options.
Right? You're
A
not.
mandate is
You're not giving
Yes.
options with this. You're given the 3 options.
option 1, 2, or 3.
Yeah, but that's
So you still have to do one.
that's still not an option to not take it.
I see what you get. I see what you're saying. I see what you're saying.
I just think if you went with the idea like Max says, of the notification, I mean, people at this point have made up their mind what they want to do with their kids anyway. They've made up their mind what's best for them and what's best for their kids. If they want to send their kid to school, they're going to send them to school. If they are watching and say, no, my kid's got a fever, I'm leaving him home today. Or no, I'm going to send my kid to school, but I want him to wear a mask. They're going to tell their child to wear a mask. I just think that I think we're trying to get a little too deep in telling everybody what to do still, when all we need to do is just say, listen, your child was labeled as a close contact. Let's give you guys, this is what we think. And I guess you could even say this is what we've done in the past, but let them make up their own mind. If they want it, and let them decide what's best for them and what's best for their kid. I mean, everybody's to that point now, I think.
And those who want to be vaccinated have been,
Have been
or can
vaccinated.
be, right? All the way down to 5.
I mean-
5-year-olds get vaccinated now. So there's that extra level. of
From my-
protection for
And I
those
don't
that
disagree
want
with that. And again, I think I've said that earlier, that I don't disagree. That there's different levels of that. The problem that I have is that when we're even in this discussion, we're saying, let people decide what they want to do with their kid. Okay, we're putting in the singular of their kid. I'm trying to actually open it up to be able to say, we have a responsibility to not only look at that one, but several. And for us just to say, okay, well, let families, take a look at, and they should be able to actually do what they want with their kid. You're absolutely right. I don't disagree with that. The only thing that I have to actually remind us of is that we're not here for just one kid or this kid. We're here for hundreds of kids.
I don't think anybody's saying we're not here for hundreds of kids, but if you're still giving them the choice of what they can do. If your kid wants to go to school with the mask on or wants to be notified, then fine. I mean, in my honest opinion, if they call me and say, your child's been labeled as a close contact, we want you to know this. Am I gonna check them, make sure they don't have a fever, make sure they don't have a cough, make sure they don't have any signs of COVID? If they do, am I gonna keep them home? Yes. I mean, that's the same as that's respectful to everybody, isn't it? I just don't
Except for the fact
understand.
that the way you're using the word options is basically, you don't like this option, you don't like this option, or you don't like the third option. So yeah, let's not consider those options. Let's consider them just not doing anything and coming to school.
Yeah, if the kid's healthy and fine, why can't we go to school?
Because what if 4 days later, she starts showing symptoms?
Then you keep them home. I'd keep my kid home if they showed symptoms.
Right. But in those 4 days, they could have been exposing other kids.
Yeah.
So what?
Yeah, they
Is
could have
that-
been.
is
I
that-
mean, but honestly, how much are we spreading it when we're not having signs or symptoms? I mean, no one can really answer that question either.
Say that again.
If you're not fevering, if you're not actively shedding a virus, how much are we actually spreading it?
You can. You can be asymptomatic. You can still be spreading it
spread
even
the
though you
virus.
don't have.
Okay, well, we can disagree on some things too.
And that, I think that we're not gonna come to a consensus on a lot of this stuff. It's just not gonna happen. I don't think there's any way that we're ever gonna agree on a lot of things. That's just, and I think the discussion, of the quarantine protocol, I don't know, I feel like we've pretty much beat that horse all different ways tonight. I don't know if, is there anything else anybody can say that hasn't already been said about this?
Mr. Chair, if I may, I think we were kind of either on recommendation or notification. I think that's, and maybe that's not where we can come to consensus on or not. I think that's kind of restating exactly what you just said, but I didn't know what direction you would like me to proceed with, either to insert recommendation or to insert notification in there.
My
Myself,
preference would be notification.
I would agree with that.
Mine would be notification.
The notifications without all of the options? Is that what you're saying?
If I may, I think you had spoken of giving notification that these are the options that we've had in the past. I do believe that it is important, even though I think, like you had referenced, that a number of families probably already know or probably have already experienced this and had to make those choices. I think we still have a number of families that when they have or hear those things from someone, at least start thinking about that process. Because if you called and told me, hey, your kid was exposed and I'm not gonna be involved in the rest of this conversation, I think that's different than saying, like you had referenced in the past, this is what we've done, that your child can come to school, or you're not can, we should wordsmith this however we want to, but option may be to have them come to school with a mask for the next 10 days and so on, those different options, at least to refresh people's memories. Because I think as we get further and further from having that occur to a family, you kind of tend to forget what typical things would be for recommendations from CDC are. We can bring that in any fashion that everybody's comfortable with.
I guess that brings us to the attendance policy. I think it's tough because we're basically still telling them CDC recommendations. And then we're going to try and enforce an attendance policy. So I don't know.
If I may kind of speak to this,
Yeah.
I think, and I could be wrong because I've not had this question directly asked me in the last couple of weeks. I think in certain situations, there has been a perception that instilling this policy would then turn around some things. We still have the tools that we've had in the past, dealing with the county attorney, dealing with truancy. Not having this policy doesn't take those things away. It doesn't mean that we can't, if there's an obvious situation where it is a truancy situation, not having that policy doesn't erase state statute. It does possibly change the conversation in some ways. But in my experience, if an administrator has a concern with truancy, we have followed up with those and actually recommended or had the county attorney involved in writing letters, even during this process where it was very apparent that it was not COVID related. So I would be hesitant in reinstalling the attendance policy with where we're currently at, and I think it should be revisited at the end of the school year. Or as long as we have a situation where we're strongly recommending kids still stay out of school, even for a positive test of 10 days, because you're getting into those same ramifications when it's COVID related. And then you're automatically, because it's policy related, requiring administrators to have a conversation with a family that we already know it's COVID. We already know it's this. Why do we need it? And I also think that there will be some more state legislation coming down in regards to truancy that we will need to revisit our attendance policy anyway, to write it to reflect possible future state statute.
And I could agree with that. I think I am hesitant just because we are getting closer to the end of the school year, to try and change this. That's just my feeling.
I would agree with that as well. The only thing that I guess I would say to this, and once it is revisited, in looking at this, again, we're talking about K5, K6, K5 in Torrington Lingle, K6 in Southeastern LaGrange, where those age of students, they are dependent on their family. I would recommend in the sentence that each Goshen County student must take responsibility for his or her attendance. I would recommend that we add each Goshen County student and family must take responsibility for his or her attendance.
Tell me that page again.
That's page 6. It's the front page. Because when we're talking about that age of students, they're dependent on their parents to get them to school. And I would even say on the secondary as well. I think that families, in some cases, it's families that need to get kids to school and make sure kids get to school. Not total responsibility lies on the student.
Mr. Kramer, how does like, for example, we have a virtual learning day. That's set up in the event of a snowstorm ahead of time. How does that work for a kid who is home for 3 or 4 days? Can he go into virtual learning?
So currently, we do not have the virtual learning option for families if it's not directly COVID related. Because in past year where we tried that, there became a heavy burden on the teachers because it does create another situation where they're having to create an alternative lesson. In some classes, it works very seamlessly. Honestly, 9 through 12, it is not, and most teachers have been able to, in a regular classroom setting, and when I'm referring to regular, Otto, Woods, obviously, totally different situation. But in most of those situations, but when you get down to the middle school aspect, we also did experience some challenges with behaviors, also coming from students in relation to being able to have that option. And we do know we have a strong preference for in-person learning. We do believe that we can adapt technology-wise to provide education, but we prefer that to be face-to-face, and it actually provides that teacher that opportunity too for direct feedback when possible. But if it were a medical situation, we have considered that for some of our families because those are unique circumstances that we want to really have those conversations. But what we were finding is it was more predominant in we're not wanting to go to school today, so can I Zoom in? But if there's ever an occasion where there's a medical circumstance, I would highly recommend any family visiting with their school administrator to kind of coordinate with teachers that this may be an option, so they don't have to experience our great loss of learning.
And it doesn't affect their attendance.
That's correct. Also, in going back to that attendance piece, because that's probably one of your questions, so I apologize. We have a virtual education plan, and that part of that virtual education plan, when we instilled Platte River School, we are able to offer virtual education because of that piece. Where if we did not have a virtual education plan, there would not be the ability for us to count attendance virtually. There are some changes coming to that chapter 41 is what it's referred to, that will be coming down, providing a little bit more specific guidance. But from what I've seen in what they're suggesting, it doesn't look like there'll be drastic changes into how they might be counted for days and time.
Well, I guess my question is I have heard that there's issues without the attendance policy of kids just not coming because they just don't want to come. It has nothing to do with being sick. It has nothing to do with excused absences. And I think we've left principals high and dry with the ability to do something about that, with not putting the attendance policy back in place. I think we have protocols already for if those kids are sick, need a doctor's note or whatever it is. But for those kids that just have decided, I'm going today, I don't know how do we get those kids back in school?
And I think that kind of depends on the level also, because we're looking for those avenues of the stick or the carrot piece. And I think what we found also even before this is that a lot of times those consequences don't result in the swift change. For some families it does. And I still think we do have that ability. Most recently, we did have a student that I think probably rose to a significant concern, and the county attorney was able to assist us in that. And so I still think there'll be some frustration because it is a judgment call on some. As we've experienced in the past. But I still think if it's an egregious attendance issue, we do have that support. Those ones that kind of fall in between, you're absolutely right. But when I look at our policy, until that last time, that final one, there really isn't the ones that resulted in immediate change for the parents. I think it requires us as administrators to have regular contact, try all avenues to get in touch with parents. That probably has been the most problematic, is when we're seeing the ones that are the most troublesome are parents just refusing to answer the phone anymore, and saying, you know what, I'm not involved in the conversation. And so that relationship has been broken. And then so how do we reach that point and then reinstill that need, they need to be in school?
Yeah, because my understanding is we're not talking about just high school students. We're seeing that down in the lower grades as well of kids and parents, because Carlos, you're right. When you're getting the lower grades, it's the parents that need to get the kids to school. And so parents are saying, don't want to go, don't go. And
I think it is a reflection right now of our society and some of the troubles that we're seeing, because it has been more prevalent. I think we're seeing the same thing in the workplace and all those things where people are making different choices than they ever have before due to the pandemic. And I think it's certainly, we're seeing that in our schools. I don't know that having this policy would dramatically shift that.
okay. Do you have any idea? You said that you think maybe some changes are coming down legislatively. Do you know what those changes?
It deals mostly
about?
it deals mostly with the truancy definition and how we refer to it in policy. They're still going to go through, I think, some committee conversations around it, because those conversations have shifted over the years, where I think there was a lot of a lot of desire to really more or less bring the stick again, and knowing that that's how we're gonna drive home attendance. But then we also have a number of situations in families where some absences could be educationally related too. That there has to be that kind of balance and that in between. And I think we're very fortunate, our county attorney is very supportive when we need to be, but also ask high quality questions on, have we done our due diligence in having these conversations with families? Have we done the things to either address other issues that might be prevalent in the home outside of what a consequence might have? And those are always good questions to ask, because we know a lot of times the consequence alone isn't going to change the behavior. How are we going to shift some of the help to those families that there's something that family is needing?
So just, again, just looking at this, where it talks about communication. And again, I understand notes because that's probably my generation of how things were done. But trying to catch up with the times, will an email suffice for a note?
I actually can't answer that directly. I don't know for sure with some of our administrators, because I haven't visited specifically with that question to know for sure. I think actually what would probably be the best idea is taking this to policy committee after we've seen what has happened in the legislative session, and determine how can we update it to actually reflect one, new state legislation if that exists, and also updates relating to technology, because I'm guessing the last time that this was revisited was in 2014. So obviously technology wise, certainly some things have changed, definitely in the way that doctors provide notification or information on.
Yeah, just specify if an email will suffice, who that email should be directed to, so that way it gets, because if I give my kid a note and say, hey, take this to, Miss Fletcher, it's to the bus driver or somebody else, and unless I specifically tell them. So, okay, that makes sense. Thank you.
Their backpack for a week.
You find it.
Yeah.
Thanks.
Anything else on the attendance policy? Okay. Item number 3 is the leadership governance board self-evaluation. Trustee or Chairman Miller mentioned something about potentially moving this to our next regular meeting, just in concerns of time and everything. I don't know, everybody had a chance to complete theirs or where we're all at in that process, but it's completely up to you guys what you want to do. I'm fine with whatever.
I didn't complete it because I thought at the end of the meeting, we decided that there was a rough draft and it was more for discussion purposes at this point anyway. So I didn't complete it, but I would hate to see Chairman Miller out of the conversation, since this is something that was important to him. And so, yeah, I'd be in favor of moving to the regular meeting.
Yeah, I was under the same understanding that, and it says draft, so I didn't fill it out.
Yeah.
Because that's what I thought. Yep. We were going to talk about, does the format work? If there's anything else that needs to be added. I don't know if anybody else.
Fine with that. Okay. Anything else that we need to discuss tonight? Anybody have? Dylan, do you have?
Oh, I was just making sure where we, did we have something exactly what we're gonna add into the close contact, or?
So I think where we were was, we were trying to decide whether it was a recommendation or notification. And from there, I think that it'll be on the agenda, and from the sound of it, I don't think it's going to be on the agenda, just getting rid of everything. I think it's going to be structured as notify of the options. And then as far as framework and stuff goes, this is just my understanding, but I think that's something for a future meeting, or a policy committee or something like that. If we think we want to put this into a policy, where do we stand on the
protocol and how it's gonna be worded or how we're gonna.
So I had circled notification, and so I was gonna do some editorializing, go through there, make the changes on notification, try to change that to, I think what the desire is to still inform, but also then providing the understanding that this is not a requirement from the school. These are the options that we've used in the past. This is something that's available. Also updating with, this is available antigen tests. The other piece that I actually forgot to ask, I'm glad we're revisiting this, is we did make a purchase of COVID tests for our staff, and we do have those available in the office. Our nurses were not, for this process, comfortable in having students, but we also, if a parent, we call a parent and say, if you want your student tested, we have those available in the office. I have no preference going that direction, but I also would be remiss in saying that we couldn't offer that same option for students as we do for staff, because right now, staff member comes down, rather than making an appointment at the clinic. These are antigen tests that Dr. Harris had recommended, and so each school already has a quantity within their offices right now.
What do we need to get that in writing? Like currently they send home or will you allow my kid to have a list of medications and stuff? When do we have to get that in writing? from every
That could
parent?
be, or what we could do is just send it home with the student. Say, if you want to come pick up your child, here's a take-home test if you don't have one. Utilize this. If we didn't want to have them to do it at the school, I mean, just offer
It just seems like it could be a slippery slope.
the ease of, I think the idea and the question from the nurses was, how can we make this easier for families? You know, if they really are, concerned, if you're showing signs and symptoms, if you want to test your child here, you can have our test, take it home, use it as you see fit, because we can do the same thing with the federal ones that are requested, but we don't have to go down that direction. I don't have any strong preference either way, but I also know that some families, finances or ease of access to go down to the pharmacy, for some of our families, it's not easily accessible. But if you view that differently,
Do you know if the test that we have, is there an expiration date on it?
July.
Okay, so rather than waste them, I would say offer.
I think as long as I think if it's a send home type of thing, I think it would be fine. I think, say, hey, if you want one, take it. They're available, take it home, do what you want with it. Yeah, that's how I do that. But
One thing I'd like to add to the notification piece. It's just a little bit closer to me because it did have a educational impact on my child. I think there needs to be, I think it should be wrote down in here, wrote down somewhere, when the appropriate time throughout the day is that we notify children of any sort of COVID-related anything. There's been numerous times where it's disrupted the students' learning and day, and I just think we can use better judgment on when to notify the kids.
So you kind of have to notify them when it happens though? Because if someone tests positive and you wait to the end of the day to tell them. doesn't that
I think
make
it's
more sense?
probably in high school, I think it's probably referring to if you could wait till the passing period, or finding out if there is a assessment going on, or those type of things that the student could affect the student in a negative impact if they're pulled from that classroom. That it is acceptable to wait till the end of the period. I think
But if
that's,
we're that worried about them getting everyone else sick,
I don't know.
they don't get them sick while they're taking the test.
Well, I don't know that 15 minutes or 20 minutes or even 30 minutes of waiting for that to not disrupt their test taking and could negatively impact that test. I don't know that would
But doesn't that make the contact tracing moot at that point then? Because then we contact trace based on how close they are to someone for a certain amount of time.
Yes,
It just seems contradictory to me.
if we want to, I'm all for disrupting the
Sorry,
kids.
I don't mean to keep
test.
picking
I'm-
this gap.
I'm-
It seems like if we're gonna still freak out when people test positive.
I guess the situation would be, we can't have it both ways, is what I'm
Yes,
saying.
yep.
Is if we want to do it right away, we will disrupt any class period we want. I'm 100% fine with that. I don't
And
have
no
a
one
problem.
wants disruption. I mean, that's why we're doing this, is to not disrupt education. It just seems like if we're gonna wait till it's convenient, we would just leave them in class.
I don't have it, like I said, I don't have a,
No, I know.
it's,
All I'm saying is my kid was disrupted during semester test, and if that happens again, I'm gonna come on court. So
No,
we
and I
can write
understand,
down
because that is
however we want to
disruptive.
write it down. It's just, it's a problem and it should be communicated in a way that, I don't care what we do, their education should come before people freaking out during their class period saying, come put on a mask. I mean, however we do it, but
Well, do we come down back to the judgment call where, yeah, if they're taking a semester final, okay, or whatever the case may be, but once again, we're going to somebody's perception of what's important or what, so I think that regardless of what direction you head with that, that's a tough one.
I would put it back to consulting with administrators and using the best judgment for all students involved.
I would say so too.
Anything else? That, we're adjourned.
A little bit. I also think.